Hello, this is Dr. James Camp from Lee College in Baytown, Texas, and this is the first of a series of 4 lectures that myself and my partner, Dr. Ross, will be doing on the articulations of the skeletal system. Now, to start you off, what is an articulation? Any place where 2 bones in the body come together, maybe they meet very closely and just have a little bit of collagen fibers stitching them together, or maybe they come together a little less closely and they have a big chunk of cartilage binding them together here. Or maybe they come together in such a way that one of them has a curved surface and the other has a curved surface, and there's going to be a joint capsule around this that allows a great deal of movement at this joint. Okay, so that latter kind is referred to as a joint, okay, or a synovial joint. The other two sometimes are called joints just for ease of terminology, but really are fibrous and collagenous articulations. They don't, when you think of a joint, you think of something that has free movement to it. And obviously, this first one, where you just have a little bit of collagen glue binding this set of bones together, is not going to be movable. Okay, that's like the sutures in your skull, perhaps. Okay, so let's talk then about how we name articulations, okay, aka joints. This naming scheme is mostly used for those freely movable joints that I talked about on the first slide, the ones that have a joint cavity and some amount of free movement. We have special names that are given to other joints, though there are some more stiff joints that still use this naming articulation, this articulation naming scheme. So the first, there are 3 basic schemes for naming articulations, and the first one is what I call the bone-o-bone nomenclature. Okay, so if we start with the humerus coming in to a point on the skeleton where it meets the ulna, okay, you would call that your elbow joint. But in fact, if you look at the elbow closely on a skeleton, there are 3 separate joints there, one between the humerus and the ulna, one between the humerus and the radius, and one between the radius and the ulna. So how do we know specifically which joint, which of those 3 articulations we're speaking of? Okay, we name humerus, so we'll take humor, we'll drop the us for the time being, and we'll add an O, which you'll notice the more you study anatomy, O is the universal Latin or Greek anatomical terminology for sticking 2 things together. If something is below and to the left of the eye, you would call it inferolateral, okay, as opposed to inferior and lateral, which you could also say. But inferolateral just sounds more sophisticated, so why not do that? Then we'll take ulna and we'll convert it into its adjective form in Latin, which, if you remember from our very first unit where we learned the names of the regions of the body, we had brachial and acromial and femoral. All of those things ended with an AL or an AR, and that's how you make an adjective in Latin. So we're gonna, ulna happens to get converted to ulnar. Whoa, what did I do there? ulna happens to get converted to an AR. Okay, so humero-ulnar is our name for this joint. Then we just stick the word joint at the end of it. Let's think of another couple of bones that kind of famously come together. We can talk about the tibia and the femur. And so again, we drop the last letter in tibia, and so we get tibi O. And then to make the Latin adjective form of femur, you actually have to change the U to an O. Okay, so it's femor. How do you know that? I'm afraid that's just one of those oddnesses of the language that you have to memorize. There's no rhyme or reason that I'm aware of why femur turns into femor, but you know, ulna stays as ulnar or whatever. Okay. A lot of these things, though, you can think about it, and humero-ulnar doesn't sound quite right. So humero-ulnar, you know, that's easier to remember that it kind of sounds right. There are some other ones that come together, like if you remember, the first two vertebrae are the atlas and the axis. They're stacked on top of each other, so of course they're going to form a joint. This is another one where the Latin changes a little bit. Instead of atlo, we add atlant. Oh, okay, that's another one of those weird exceptions you just have to memorize. Atlanto, axi, ol, joint. Okay, so this one has that weird little Atlas to Atlantis thing, but atlantoaxial, the rest of it behaves normally. O-axial joint. Can we think of any other ones that that we want to form that maybe are a little weirdly behaved or something? There's at the bottom of the spine, we just covered the top of the spine, we have the sacrum forms a joint with the coxal bone, but there's a specific part of it. It forms it with the ilium. Okay, so we're going to have the sacro ili, and again here we have a little weirdness to the adjective form is ac instead of al or r, iliac. And that happens with a lot of the pieces of the coxal bone. Ilium becomes iliac, pubis becomes pubic. So you just have to know a little, you have to memorize some of your Latin adjective forms, unfortunately, to get these joints right. Okay. The good news is, however, going in the other direction is not that hard. If somebody gives you the name of a joint, it's very easy to figure out which two bones made that up, sacrum and ilium, okay, tibia and femur. But seeing the two bones and trying to remember the name of the joint does require a little bit of memorization. Okay, so the second form, which is not nearly as common, is the structurobone formula. Okay, so this is in a case where the bone in question doesn't form a joint with the whole other bone. It forms a joint with a small structure. So, for example, the glenoid fossa or cavity of the scapula forms a joint with the humerus. Okay, so we stick that together and we get Glen O humor ul, and then of course we add the word joint at the end, glenohumeral joint. There are others. The other one that forms a joint with the scapula is the acromion of the scapula forms a joint with the clavicle. So we get the acromioclavic. Again, here we have a slight change to the word clavicule, our joint, acromioclavicular joint. Okay, my favorite is probably where the hip joint, the acetabulum, forms a joint with the femur, and so we get acetabulo femoral joint. Okay. The structure doesn't always go first. There's another part of the body where the talus, that little part of the heel that sticks up, forms a joint with the fibula on one side and the tibia on the other side. And instead of calling this the talotibiofibular joint, which is hard to say, much less write out, they say that it forms a joint with the crura, or leg. Okay, and so we have talocrural joint. Okay.
That is definitely Bowser.
Finally, there's the interbonal pattern. Okay, this happens when the two bones have the same name, and you're not going to say, well, it's the third vertebra, fourth vertebra joint, or, well, that's a proximophalangeal, distophalangeal joint. Okay, you're just going to say it's two phalanges or two vertebrae. And so this comes together with, we use inter, and then the name of the type of bone. Phalange ul, okay, or in my other example, inter vertebral. Okay, there are also intercarpal joints between your carpals and intertarsal joints between your tarsals. Okay, finally, there are some special names where the two halves of the pubis come together. Remember, we've got that pubic bone with its two rami, okay, that comes together, and then there's a big hunk of fibrocartilage there that stitches the two of them together, and that is called, that was horrible, draw an arrow here, okay, that is called the pubic symphysis, okay. And then, of course, anywhere where you have two skull bones coming together and there's just a little bit of fibrous tissue joining them together, that is called a suture. And we have 4 named sutures that you learned when you were studying the bones of the skull. Okay, so find each of these on a skeleton model. There are 4 named sutures. There's a temporomandibular joint. Okay, that's going to be up here where the temporal bone and the mandible form a joint. TMJ syndrome is a very common problem that people get if they grind their teeth a lot or something. There's an atlanto-occipital joint and an atlanto-axial joint. There are like 20 intervertebral joints. At each place where the vertebra, where a thoracic vertebra meets a limb, it meets a rib, sorry, there is a vertebrocostal joint. And then at the bottom of the lumbar spine, there is the lumbosacral joint. There are also sternocostal joints, where the sternum meets the ribs. Okay. And costochondral joints, where the ribs meet their cartilage. Okay. If we look at our one bone, two bone, lots of bone pattern, there's our humerus, radius, ulna, carpals, metacarpals, phalanges. Okay. There's a glenohumeral joint here, a humero-ulnar joint here, radio-ulnar joints proximally and distally, a radiocarpal joint where the radius, it's mostly the radius, there's a little bit of humerus, a little bit of ulna there as well, but mostly the radius meeting the carpal bones. There are carpometacarpal and intercarpal and metacarpophalangeal and interphalangeal joints. Okay. If we look on the other side, got our big hip bone, femur, tibia, fibula, talus, calcaneus, lots of other tarsal bones, metatarsals, and phalanges. So we've got an acetabulofemoral joint here, a pubic symphysis here where the pubic bones come together, a tibiofemoral joint here, and also a patellofibular joint where the patella meets the femur. We have 2 tibiofibular joints, one proximal, one distal. We have the talocrural joint we mentioned earlier. There's also a subtalar joint where the talus sits on the calcaneus. Intertarsal joints all over the place, tarso-metatarsal joints, and metatarsophalangeal joints. Okay, so that concludes the names of the major joints, the major articulations of the skeleton. I'll now pass you on to Dr. Ross with a study of the types of joints.